Do you know the silent symptoms that often accompany ovarian cancer? This disease is a prevalent health concern among women worldwide. Its symptoms can be elusive in the early stages, making it challenging to detect until it has advanced. Despite challenges, understanding its risk factors, symptoms, and treatment options can make a significant difference in outcomes. Today, we delve into the 12 things you should know about this health concern, arming you with knowledge that could be potentially life-saving. Ovarian cancer is often referred to as the silent killer. But why is that? Well, it's because the symptoms of this disease are not always obvious, especially in the early stages. This can make it incredibly tricky to detect until it has significantly progressed. Let's delve into the silent symptoms that often go unnoticed. These could include subtle changes like abdominal bloating or swelling, pelvic pain, difficulty eating or feeling full quickly, urinary symptoms such as urgency or frequency, and even changes in bowel habits. Remember, these symptoms can be associated with many conditions, not just ovarian cancer. However, if these symptoms persist, it's crucial to consult with a healthcare professional. Moving on to risk factors. Age is a key risk factor as the chance of developing ovarian cancer increases with age. Family history plays a significant role too. If you have relatives with a history of ovarian or breast cancer, your risk might be higher. Inherited genetic mutations, specifically BRCA1 and BRCA2, also increase the risk. Certain reproductive factors come into play as well. For instance, not having children or having them late in life could increase the risk. This understanding is not about promoting fear, but fostering awareness because knowledge is a crucial tool in tackling this disease. What are the common symptoms of ovarian cancer, and why is screening a challenge? Let's unpack this. Symptoms of ovarian cancer can be subtle, which is one of the reasons why it's often known as a silent killer. These symptoms can include abdominal bloating or swelling, pelvic pain, and difficulty eating or feeling full quickly. Urinary symptoms such as urgency or frequency are common, and changes in bowel habits can occur too. The insidious nature of these symptoms can make them easy to dismiss or attribute to less serious conditions. Now, you might wonder, why can't we just screen for it? Unlike some other cancers, ovarian cancer doesn't have widely recommended screening tests for the general population. The existing screening methods, like the CA-125 blood test and transvaginal ultrasound, aren't highly effective at detecting early-stage ovarian cancer. In fact, these tests aren't consistently successful at reducing mortality rates from the disease. This is largely due to their inability to differentiate between benign and malignant tumors reliably. The lack of effective screening methods further amplifies the challenge of early detection. Hence, recognizing these symptoms can lead to earlier consultation and detection, which is key in the battle against ovarian cancer. So, how is ovarian cancer diagnosed and what are its stages? Let's delve into that. Diagnosing ovarian cancer typically involves a multi-step process. Initially, medical practitioners will evaluate a patient's medical history and conduct a physical examination. This is followed by a series of imaging tests like ultrasounds or CT scans. A blood test, specifically the CA-125 test, may also be administered, as it can detect a protein that is often found in higher levels in ovarian cancer patients. However, to conclusively diagnose ovarian cancer, a surgical biopsy is often required. Upon diagnosis, the next crucial step is to determine the stage of the cancer. This is done based on the extent of the disease's spread within the body. The stages range from 1 to 4. Stage 1 signifies that the cancer is confined to the ovaries. Stages 2 and 3 indicate that the cancer has spread to nearby organs or lymph nodes. Stage 4, the most advanced stage, signifies that the cancer has spread to distance such as the liver or lungs. It's important to note that early-stage ovarian cancer, specifically stages 1 and 2, generally have a better prognosis than the advanced stages. This underlines the importance of early detection and intervention. Knowing the progression and potential treatment strategies is critical. What are the available treatment options? And what does prognosis mean in terms of ovarian cancer? When it comes to ovarian cancer, there are several treatment options available. The first line of defense is usually surgery, where the tumor and surrounding tissue are removed. This may be followed by chemotherapy, which uses drugs to kill cancer cells or stop them from growing. In some cases, radiation therapy or targeted therapy may also be employed. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. On the other hand, targeted therapy uses drugs or other substances to identify and attack specific cancer cells without harming normal cells. The prognosis, or outlook for ovarian cancer, varies greatly. It is influenced by a variety of factors, including the stage at which the cancer is diagnosed, the type and grade of the tumor, the patient's overall health, and how well the cancer responds to treatment. The stage of the disease is particularly important. Early-stage ovarian cancer, where the disease is confined to the ovaries, generally has a better prognosis than advanced-stage disease, which has spread to distant organs. However, every person's experience with ovarian cancer is unique. Some people respond exceptionally well to treatment, while others may not have the same outcomes. What role does genetic testing play? Let's delve into this aspect. Genetic testing can be a vital tool, especially for women with a family history of ovarian or breast cancer. It assesses the risk of hereditary cancer syndromes, such as mutations in the BRCA genes. If you test positive, this information can guide your screening procedures and strategies to reduce risk. It's like having a roadmap to navigate an otherwise complex and uncertain journey. Now, let's talk about advocacy. Advocacy organizations for ovarian cancer provide resources, support services, and educational materials. They also raise awareness about ovarian cancer risk factors, symptoms, and research efforts, ensuring that ovarian cancer is recognized and countered. Turning to clinical trials, these offer eligible patients access to experimental treatments. By participating in one, you're contributing to advancements in ovarian cancer research. Remember, you're part of the solution, part of the fight against ovarian cancer. There's an entire community of support, from doctors and nurses to researchers and fellow patients. They're all in your corner, cheering you on, providing the help you need, and celebrating your victories with you. Lastly, the fight against ovarian cancer is a collective effort. It's a symphony of science, advocacy, and support, all working in harmony to improve prognosis and enhance quality of life. And remember, every step, every discovery, every voice counts. What happens after treatment? We delve into survivorship. Once the rigorous process of treatment concludes, the journey of survivorship commences. This stage is marked by the need for a thorough plan to monitor recurrence and manage potential long-term effects. Survivorship doesn't merely revolve around physical health, it also includes emotional well-being. It's about finding a new rhythm in life post-cancer, embracing all its changes, and marching forward. Medical checkups form an integral part of this stage. They provide a platform to discuss any concerns or challenges you're experiencing. Imaging tests as part of your care plan afford a detailed look into your body to help detect signs of cancer recurrence. Such tests are key to maintaining your health. Additionally, support services have an essential role in survivorship. They offer resources to tackle physical, emotional, and practical hurdles, thus providing a comprehensive approach to recovery. It's important to remember, each person's journey is unique. Open communication with your healthcare team ensures your plan meets your individual needs and circumstances. Remember, awareness is our best weapon against ovarian cancer. Thank you for taking the time to learn about ovarian cancer. Don't forget to subscribe to our channel and click on the notification bell for future videos.